Why did you become a veterinary oncologist?
It was actually a bit by chance. I had originally gone to do a placement during vet school at a hospital where I thought I wanted to do internal medicine. And unfortunately, the placement fell through. And this really lovely medical oncologist said that I could do my placement with her instead. And initially, I was a little hesitant because I didn't like the idea of cats and dogs having chemotherapy. My mom had gone through chemo at that point, and I just felt like that would be a bit rough to put a cat and dog through. But I was kind of stuck between a hard place and a rock. So I said, sure, I'll do the rotation with you instead. And then what I realized was her patients were the happiest ones in the hospital. She absolutely spoiled them, and I learned a lot about how the doses of chemotherapy in cats and dogs are much lower than what we give people. So they're aimed to make a pet feel better and be high enough to kill cancer cells so that they can live a more normal life for a period of time. And side effects were actually quite rare. So I was really impressed with how their quality of life was, and I just found it so fascinating that I ended up wanting to do that, and she became my mentor, and here I am years later. I'm an oncologist.
What do you find the most rewarding about oncology?
I think the most rewarding part of my job is being able to give owners more time, but really good time with their pets. It's very hard to hear that your pet has cancer, particularly if it's terminal. And it can feel a bit hopeless. And I do take a lot of pride in supporting people through that initial period of grief and helping them find an option that works for their family and their pet, their budget, and figure out a way to make sure the time that they do have left is as good as possible. And it's really rewarding to see pets go from feeling so unwell to feeling so much better and having the ability to essentially improve their quality of life for a period of time.
What happens at a first oncology appointment?
So at your first oncology appointment, what generally happens is we go over the diagnosis together and all the information we have so far from your referring vet. And we kind of go over essentially everything you need to know about the cancer, how it tends to behave, the prognosis, treatment options, and if needed, what kind of tests may be worth doing to get more information for you or to help guide your treatments further. We'll go over the pros and cons of all those treatment options and the tests that may be appropriate to do, as well as the cost, so you have an idea of what that all entails. And usually on the same day, if you would like to, we can facilitate starting either treatment or do additional testing if needed, which is why we ask people to bring their dogs fasted, just in case we need to do something that day. The other option is you can go away with that information and I can send you a summary so you can have a think and discuss with your partner, your family member, whoever, about everything and make a decision and come back as early as the next day if you would like to.
How do we decide whether treatment is worth pursuing?
So my job is to essentially go through what options are available, the pros and cons of those options, so whether they're likely to work, things like what they cost, whether there's side effects from those treatments, and to kind of help you weigh those things out and kind of balance it against the potential benefit of each treatment option. At the end of the day, my job is to give the owner as much information as possible and to help them make a decision that's right for them and their family and their pet, not to tell people what to do based on a formula in a book. So, at the end of the day, my job is to give you as much information as possible and answer any questions you may have so that you can make an educated decision on what's right for your pet and basically make the right decision for your pet.
Does seeing an oncologist mean I have committed to treatment?
Not at all. I think a good portion of consults that come through, the owners just want to know more about the diagnosis and have an in-depth discussion with somebody who focuses in this area rather than getting maybe a few answers from their regular vet who doesn't know about the cancer as much, and just wanting to know what's possible and what can be done, what can be considered. And I think sometimes owners just want to know if there's anything that can be done to make their pet more comfortable. And sometimes people just want to know that it's okay to let their pet go if the prognosis is poor. And we can have that discussion when we have the consult and go from there.
What are 3 things you want every owner to know before their first appointment?
That one, ultimately my job is to just give you as much information about your pet's diagnosis and to make you aware of all the treatment options that are available to you and perhaps further diagnostic options if they're needed. The pros and cons and the relative costs of those options. 2, you don't have to choose to take any of those options, but it's good to know what they are. But I never want someone to feel like they have to pursue any of the options we discuss. And 3, that everything we offer will be geared towards improving a pet's quality of life and giving more time with their owners, feeling as normal as possible and ideally back to their normal selves.
What is the hardest misconception about veterinary oncology?
I think a lot of owners and vets actually really expect that veterinary oncology will be exactly like human oncology, which it's not. The doses that we give to humans versus cats and dogs are very different. If you're a 20-year-old, a man or woman who gets diagnosed with a life-threatening cancer, you may be willing to go through some pretty grueling treatments, which have some very scary and unpleasant side effects. Sometimes people can actually die from the treatments, but you can consent or say no to those treatments. And for a person who is 20, for example, they may want to live another 50 years and those risks are worth it. But for a dog who's, let's say, a 12-year-old dog with perhaps their natural lifespan would only be another year or 2, it doesn't feel as fair to put them through the kinds of grueling doses and treatments that we would put a person through, because 1, they can't consent. 2, we're not trying to get them another 20 to 50 years, depending on a human's age. And at the end of the day, our goals are just ultimately different. So for people, it tends to be quantity of life at any cost, whereas with our patients, it tends to be quality of life, not quantity of life at any cost. So I'd rather a patient have 6 months of really good quality of life with treatment and low dose chemotherapy relative to what we'd give a person than give them really high doses of chemotherapy and really intense treatments that mean they live, 2 or 3 years, but they hate every minute of it. So I think the biggest difference is that the approach is a lot less aggressive and it's geared towards making them feel better as long as possible, not just keeping them alive at any cost.